Whenever you're ready, we'll go ahead and hit record.
All right, I'm good to go on my end.
Okay. And then I'll do a short little introduction as usual. Good afternoon. My name is Victoria Tyra, and I'm the Education and Communications Manager with Michigan Center for Rural Health, and will be helping facilitate this program. I would like to welcome everyone to today's MIPS program, and our topic today is MIPS value pathways. I'll go ahead and hand it over to our presenter, Lisa Lusuto.
Thank you so much, Victoria. So before we get started, I just wanted to take a moment to say that I hope you and all of your families are staying safe and healthy. And we're just so appreciative of all of our healthcare providers that are out there battling COVID-19 on the front lines. With that being said, today we're first going to kick off our webinar talking about some COVID-19 related updates to the quality payment program. And then we'll transition into a discussion on the MIPS Value Pathways program, which is the focus of our webinar today. So our goal for this session is that once you're finished, you will be equipped with an understanding of the future of the MIPS program that will be potentially implemented through the proposed MIPS Value Pathways program. This will include an understanding of the new framework that will be implemented in 2021, some examples of implementation at both the specialty and condition level, and then we'll wrap up the presentation by talking about some next steps for the MIPS Value Pathways program and how that might be implemented. So to kick things off, as I said, we have one COVID-19 related update to the quality payment program that we wanted to share with you all. On May 8th, CMS published an interim final rule, which set forth some additional regulatory waivers and some other changes to healthcare regulations and policies in order to respond to the COVID-19 public health emergency. The interim final rule delays for qualified clinical data registry measure testing and data collection for the 2021 MIPS performance period. CMS has made these delays in response to concerns voiced by QCDRs that due to COVID-19, they won't be able to complete data measure testing and collection in time. So CMS is going to delay that requirement. Beginning with the 2021 performance period now, all QCDR measures must be fully developed and tested with complete testing results at the clinician level prior to submitting the QCDR measure at the time of self-nomination. This process is ultimately being delayed 1 year, and the requirement will go into effect for the 2022 performance period. Additionally, CMS is delaying the requirement that beginning with 2021 performance period, QCDRs are required to collect data on a QCDR measure appropriate to the measure type prior to submitting the QCDR measure for CMS's consideration during the self-nomination period. This process too will also be delayed for 1 year, and the requirement will go into effect beginning with the 2022 performance period. So now let's transition into a discussion about MIPS value pathways. And before we get started, I think it's important to take a step back and let's take a look at the current MIPS structure. So as you may know and are familiar with, under the current MIPS reporting structure, there are 4 separate performance categories, and those include quality, cost, improvement activities, and promoting interoperability. Those 4 categories are added together to give a clinician a final MIPS score. Based on whatever your MIPS final score is, you will either receive a positive, negative, or neutral payment adjustment to your Medicare Part B professional payments. So over the years, CMS has solicited feedback from clinicians and providers regarding the reporting requirements and the structure of the MIPS program. And the biggest message CMS has heard is that this program is extremely confusing. Many clinicians have reported that the reporting requirements are just ultimately confusing. There's so much complexity to it, and there's way too many measure sets and activities to choose from. CMS has also received feedback that in some areas, having such a full range of choice within each of the 4 performance categories has lent itself to clinicians in some instances selecting measures and activities that may not be the most meaningful to their practice. Clinicians have therefore called into question the value and relevancy of the MIPS program, which I'm sure many of you feel the same way. CMS has also heard from patients that they would ideally like to see more specific information on clinicians when they go to look for a practitioner. So in response to that feedback and to comply with statutory requirements of the program, CMS has over time been making incremental changes to the MIPS program as the years have progressed. So for example, CMS was originally very focused on engaging clinicians with quality measures at the very beginning of the implementation of MIPS. CMS undertook great effort to ensure that clinicians are participating within the program and really engage with quality. So as you may recall, for the first year of the MIPS program, CMS set goals it would achieve 90% participation within year one, and in fact, it actually hit around 95%. In year two, it hit roughly 98% participation, so clinicians were certainly participating in the program. CMS has reported that seeing clinicians who previously, again, were never engaged in quality, but now are, which is great news. However, as the program continues to move forward and progress, CMS intends to shift the focus not only to participation, but really measuring and moving the program forward to one of value and ensuring that clinicians are assessed on their quality and cost or overall value. So in light of this goal and in response to stakeholder feedback, CMS has created the MIPS Value Pathways program, or if I may refer to it during this presentation as MVP. So beginning in the 2021 performance year, CMS has proposed this new MIPS Value Pathways model. And again, this is important to remember, this program may not take place until January 1, 2021. So on this slide, you'll see the new MIPS Value Pathways framework. As we'll discuss further in detail, MIPS Value Pathways are predetermined subsets of measures and activities that are relevant to a clinician's scope of practice and integrated across the different MIPS categories. So instead of choosing measures and activities to report on for each category, MIPS participants will report one MIPS Value Pathways, including all measures and activities within the MIPS Value Pathway. You'll see there's a foundational layer of promoting interoperability and administrative claims-based population health measures for all clinicians. So clinicians will then report on specialty or condition-specific clinical quality, cost, and improvement activity measures. In constructing the framework for the MIPS Value Pathways program, CMS intends to fix some of the problems under the current MIPS program based on the feedback that it gathered from clinicians since 2017. One of the main concerns CMS is addressing with MIPS Value Pathways is that the clinicians have noted that the 4 performance categories feel like really 4 separate things. And again, the measures and activities that clinicians can choose from are so numerous and broad. CMS hopes that the MIPS Value Pathways program will address these concerns. CMS also places a high focus on quality and cost and improvement activities, while having some items that would be foundational or agnostic to a given MIPS Value Pathway. CMS envisions that this would include the promoting interoperability performance category, as well as some population health measures. CMS has also indicated that it's evaluating the ways it can reduce reporting burdens for clinicians, as well as continuing to put patients at the center of the program. CMS intends to look at the ways it can further expand incorporating the patient's voice into MIPS Value Pathways, whether that be through further implementation of, patient-reported outcome measures, patient experience measures, or potentially some other innovative forms or ways of engaging with the patient. Additionally, through implementation of the MIPS Value Pathways program, CMS has identified that it wishes to remove the barriers to APM participation. The current administration hopes that by 2025, 100% of payments would be associated with an APM. CMS recognizes there's a lot of work in terms of what it needs to do, as well as coordinating with you all, the clinicians, to really ensure that barriers are removed to participation in an APM. CMS has also identified that it really needs to encourage clinicians to take on more risk. And again, as that relates to participation in an APM and how risk can either be one-sided or two-sided. Finally, CMS has noted that clinicians who participate as a group are tending to select either preventative care measures or primary care measures. For many medium or large-sized group practices, there are multi-specialties within that group. So there could be numerous specialties that would be a part of a given organization. Clinicians have noted that they really want to be able to report and be scored based off their specialty or for measures that are the most meaningful to their practice. Clinicians have also noted that they're only seeing as part of their performance measures that have been reported on behalf of their entire group, and it isn't really applicable to their particular practice. CMS intends to address this issue by making MIPS value pathways specialty-specific, condition-specific, or based on a single episode of care. Some MIPS value pathways could span numerous specialties, and within the MIPS value pathway, CMS could receive data not only at the group level, but also potentially at the subgroup level as well. So this slide shows a CMS infographic that highlights some of CMS's intentions for the MIPS Value Pathways program. So let's start out by looking at the far left-hand side of the diagram. This portion of the graphic shows the current structure of the MIPS program. So you'll see the 4 different performance categories. You'll see quality, performing interoperability, improvement activities, and cost, along with a breakdown of the measures or activities that are to be reported under each category. As I briefly discussed, CMS has received feedback from clinicians saying that the current MIPS structure feels very, very siloed. There's really 4 separate and distinct things that clinicians have to report on, and there's just too many measures and activities to choose from. Some clinicians have reported on activities and measures that may not be the most meaningful to them or their practice. There's also concern that there are about 15 to 20 different things that clinicians need to do and report on under the current MIPS structure. And overall, at the end of the day, clinicians feel that the MIPS program is just not really meaningfully aligned. So in order to remedy this issue, CMS proposed a transition to the MIPS Value Pathways program, which brings us to the center of the infographic. The goal with implementation of MIPS Value Pathways in 2021 is to create a more cohesive program that lowers the reporting burden for clinicians and creates new pathways that are going to be more targeted and meaningful to a clinician-specific practice and specialty. So there aren't any currently MIPS Value Pathways available for reporting. So you'll start seeing some closer alignment between the 3 performance categories: quality, improvement activities, and cost. And you're also going to see lower reporting burdens, more cohesive measures and activities. You'll see lower reporting burdens and more cohesive activities as we transition to the final aspect of the far right-hand side of the slide. You'll see in the center that the foundational level still exists in MIPS Value Pathways. CMS envisions that the foundational layer to be MIPS Value Pathways or MVP agnostic, which basically means that certain items will apply regardless of which MIPS Value Pathway the clinician actually reports under. So these categories will still be assessed for all clinicians. The foundation includes the promoting interoperability performance category and population health metrics or all-cause readmission measures. CMS has noted they are seeking to expand these types of metrics as well. CMS has also indicated that it does intend and understand that for these types of measures, there really is no reporting burden for clinicians. CMS further believes that being able to calculate more of these metrics can also help clinicians for moving forward into participation in advanced payment model or an APM. As we move to the right-hand side of the slide, when we think about the most future state of the MIPS Value Pathways program, and as it becomes more evolved and involved, we will see a much closer connection between quality and improvement activities and the cost category. You'll see we still have the foundational layer, but That's been expanded to include patient-reported outcome measures or patient experience measures and enhanced performance feedback. So this next slide details a specialty-specific example. At this time, we really don't have much in terms of firm guidance from CMS as to what the MIPS value pathways will look like in detail. So CMS has created this diagram to provide us with some insights as to how it could look and could function when MIPS value pathways is finalized. So here you'll see a draft example from CMS of what a specialty-specific MVP could look like for general surgery. Again, this is just an example. There aren't any MVPs that have been proposed or finalized for the 2021 reporting year. But as you can see, as part of this draft, instead of a surgeon potentially reporting or contributing to some of the metrics that a group may have overall chosen, such as primary care metrics, we're seeing now the ability for the surgeon to report on more specialty-specific measures and activities that's more meaningful to the surgeon's practice. As you can see from the call-out box here in the middle of the diagram, the number of measures and activities themselves have also decreased. We're seeing in this example 3 quality measures and 2 improvement activities, whereas you may recall from the prior slide, the current requirements are around reporting 6 different quality measures or 2 to 4 improvement activities. So you're seeing that reduction in reporting there. CMS has also published another condition-specific example, which you'll see here is for an endocrinologist who would be focusing on managing diabetic care for their patients. So again, as you can see in that center call-out box, there's a smaller subset of quality measures, improvement activities, and cost measures. CMS anticipates that as MIPS value pathways continues to get built out and developed based on stakeholder feedback, the total number of things that you all as clinicians will be asked to do under the MIPS program and through MIPS value pathways participation should be significantly reduced, while also at the same time putting a more emphasis and focus on your efforts in the areas that are most meaningful to your practice. So how exactly will MIPS value pathways work? I sort of touched on this mostly at this point already, but CMS does intend to work to build out this program and framework starting in 2021. And the goal is to provide enhanced data and feedback to you all as clinicians. CMS is exploring the possibility to provide more granular drill down detail on certain types of metrics such as cost. CMS has also received positive feedback on some of the types of feedback that is issued to clinicians under alternative payment models. So CMS is also exploring the technical feasibility to expanding that type of feedback to MIPS participants. CMS is also envisioning in a future state, again, a really increased voice and role of the patient to really ensure that CMS is accounting for the patient's voice within their care. CMS is anticipating that as it moves forward with the MIPS value pathways program, the total number of things, which covers quality, cost measures, improvement activities, could be significantly reduced. So at the end of the day, the stuff that you all need to report on should be significantly reduced, and that administrative burden should be significantly reduced or removed. It does envision under a future state, the total number of things can be lessened because the clinician's focus would really be highly focused on a specific MIPS value pathways that would either be relevant to your particular specialty or to a particular condition or episode of care. So what are some of the next steps in terms of moving forward under the MIPS value pathway structure? The specific details on how MVPS or MIPS value pathways will be constructed, how clinicians would select an MVP, how clinicians would be scored, and how multi-specialty reporting would or would not work will likely be addressed in this upcoming Medicare physician fee schedule final rulemaking cycle. This rule typically comes out sometime around the end of June or beginning of July. And CMS has not yet identified whether or not that deadline will change given the COVID-19 current public health emergency. So it's unclear as to whether the rule will come out this summer or not. And at this point, CMS has also not indicated whether MIPS Valley Pathways participation will be mandatory or optional for the first year. So stand by for further updates on this. CMS has stressed its desire to collaborate with stakeholders, as well as frontline clinicians working to develop the MIPS Valley Pathways program. So they really want to work with you in terms of implementation and getting this right. With that being said, if you're interested in providing feedback on the proposed MIPS Valley Pathways program, we highly recommend that you communicate directly with CMS in terms of how you envision the program to work and play out in your practice. We're certainly happy to help assist you in communicating with CMS. You can also participate through the rulemaking process by submitting comments when the 2021 rule comes out. And again, that's sometime potentially in late June or early July, could be later given the COVID-19 public health emergency. So we'll have to stand by for further updates for that. But as always, we encourage you to submit comments. If you have specific comments, we're certainly happy to facilitate those comments to CMS on your behalf. And as always, we encourage you to stay tuned for updates to the MIPS Valley Pathways programs as the program continues to be further defined. And please ensure that you provide feedback because this program will certainly impact your practice. So with that being said, this wraps up our discussion on the future of the MIPS program as implemented through the MIPS Valley Pathways program. My contact information is here on this final slide, so please do not hesitate to reach out to contact me or any other attorney at Hall Render if you have any questions related to MIPS or the MIPS Valley Pathways program. Hope you all stay healthy and safe. We look forward to having you join us for our next webinar in the series.